Senator Di Natale.
Thank you, Madam Acting Deputy President. One of the reasons I left my clinical practice and became a senator was because of the enormous sense of frustration I felt as a clinician when I saw patient after patient presenting with what were straightforward preventable illnesses that turned into serious, complicated medical problems requiring medication and surgical intervention. It was an incredible source of frustration to me that here I was, a highly trained health professional, in an environment where, for the most part, I felt that I was putting band-aids on problems that were preventable and that didn't need to be seeing me in that context. It was a huge sense of frustration knowing that the amount of taxpayer-funded investment in my work, in providing the medicines, in providing the specialist opinions, in providing my own advice, which didn't come cheap, as medical practitioners are not cheap. It costs a lot of money to train them and it costs a lot of money to resource Medicare adequately. It was a huge sense of frustration to me that we were prepared to invest all that money into a very expensive end of the medical system while we would only spend 1, 2, maybe 3% of our health budget on prevention. It just made no sense to me. And one of the things that, in fact, motivated me to move out of clinical practice into public health and then later into politics was to try and do something about it, was to try and fix that huge imbalance. I mean, hugely frustrating because we know what works. We know that a simple, straightforward investment in prevention is much more cost-effective than dealing with problems that become much more complicated and require much more expensive interventions. And it was with some pride that I sat back and watched my colleague Senator Rachel Siewert and members of the Labor Party work together to honour the evidence that came out of the National Health and Hospitals Reform Commission and the National Preventative Health Task Force. In fact, one of my mentors in public health, Professor Rob Moody, was involved in that task force. And it was with some pride that I sat back and watched the establishment of Australia's first independent authority focusing specifically on prevention. Finally we got somewhere. And we recognised that we needed to overcome this narrow, short-term focus, the next electoral cycle, and recognise that if we're going to start to make inroads in healthcare, we need to tackle the issue of prevention. Now, the Australian National Preventative Health Agency wasn't perfect, but it did some pretty good work. If you look at the plain packaging reforms, I mean, these are reforms that have led the world when it comes to tobacco control. I mean, that's not an overstatement. We have seen now countries right across the developed world, and in fact now even the developing world, looking at the example of plain packaging in Australia and saying that was an important reform. The evidence now is looking very strong, and it's about time we moved in this direction. And we've seen just how important those reforms are by witnessing the huge counter-attack by the tobacco industry and other vested interests. And that was work that came straight out of the work of the Preventative Health Agency, world-leading reforms. We've seen some reforms around alcohol-related harm, and specifically on the issue of pricing and the pricing of some alcoholic-related beverages that, quite openly are drinks that target young people. That is, alcopops. And we saw a change in behaviour in that area as a result of those reforms. We saw the agency work with a number of sporting bodies to deal with the issue of sports sponsorship from alcohol companies. and we've now seen some of our major sporting codes exit that space. A really honourable move, and again, thanks to the work of the Preventative Health Agency. But of course, some of their work was pilloried, particularly by the government. One of the things that was most shameful was the attack on the sponsorship of NASCAR, where they deliberately targeted a population group with high prevalence of smoking, ensured that what we got was the widespread dissemination of an innovative app around smoking. And in fact, it was recognised as such and received awards as a result of the impact it had on reducing people from smoking. Worked very well, and in fact, NASCAR audience was the perfect target group, and yet they were pilloried by the opposition. We heard at Senate estimates that having 2 people attend that event and make a decision on the basis of downloading that smoking app and ceasing their smoking, that the investment in the sponsorship of that event would be paid for and then some. I mean, this is it's not sexy work. It's not the sort of work that we'll see lead the headlines on the local news bulletin with the latest medical breakthrough, but it works. It's cost effective and it works. We know that by implementing the top 5 preventative health interventions, we can get a return for an investment of $4 billion, a return of over $11 billion in terms of the money from or savings as a result of preventing people from developing a number of common conditions. I mean, we know that. We know that. And when you've got a situation, for example, where you've got the Australian population who, according to the ABS, where we've now got nearly 2/3 of people aged over 18 who are overweight or obese, and of course we know what the consequence of that is. When you've got coronary heart disease associated with the cause of death for 51% of deaths from diabetes, that is, people with diabetes who have ischemic heart disease, it's associated with 51% of the deaths from diabetes. All preventable, all preventable. And in fact, the work around smoking, the work around alcohol, the work around obesity done by the Preventative Health Agency, targeting those groups specifically. I mean, people with diabetes, people who die from diabetes, 1 in 4 of those people will have kidney disease. Again, preventable if we do the work necessary to try and make sure that people with those chronic diseases are managed appropriately. Again, all work that we know it's not sexy, it's not glamorous, but it has a huge impact. And instead, what do we see? We see this triumph of ideology over evidence. What we're seeing now is not just the abolition of the health agency, but a cut in the investment in preventative health programs delivered by state governments to the tune of almost $300 million. So we're now seeing the abolition of the agency, the only agency we have with a dedicated focus on prevention, and in addition to that, a cut of almost $300 million in the funding for preventative health programs delivered at state level. Programs, again, targeting smoking, targeting obesity amongst young kids, working in tuck shops to give kids healthy choices around the sort of products that are available to them. All cut, all cut. And what have we got in its place? Well, we've got this crazy idea that says if you make it more expensive for people to get health care, somehow that's good for the bottom line. We're going to introduce a co-payment for someone to go and see a doctor. We're going to introduce a co-payment, an additional co-payment for someone's medicines. We're going to introduce a co-payment for someone to go and get an X-ray or some other form of radiological procedure. I mean, ideology triumphing over evidence. At the same time, we're seeing this massive cut to our public hospital system. $50 billion taken out of the growth funding promised to our public hospitals. A massive cut in the funding for our public hospitals who are already overstretched and struggling to meet the demand that exists within the community. All a massive cost shift, of course, a massive cost shift away from federal governments to the states. Then it gets worse. We finally get some transparency in the system. We have activity-based funding, a model that has been operating in Victoria successfully to introduce some transparency, to try and benchmark what it costs to perform particular procedures. And we're seeing the end of activity-based funding in our hospital system. I just don't get it. It makes no sense. We know what works. We've got the evidence base for what works, and we're cutting those things, and we're introducing a range of reforms that are going to make the system much more expensive. I mean, who dreams this stuff up? I just don't get it. And of course, all you have to do is talk to people who work in this space, talk to the academics, talk to the administrators, talk to the bureaucrats, talk to the doctors, talk to the nurses, talk to the allied health professionals. They all say the same thing. We've got some challenges in healthcare. Overall, our health system's a pretty good one. We spend, as a proportion of GDP, lower than the OECD average, but we could do better. We could make the system more efficient. And the way to do that is to invest more in prevention. Let's not just look at traditional preventative health areas like obesity, smoking and alcohol, but let's talk about healthy living environments. What do we have to do to create, around our urban planning framework, healthier living environments so that there's active transport built in and we can tackle obesity as through the sorts of environments that people live in? But no, rather than building on a successful model, we're going to cut it down. We're going to cut the funding that we've promised to the states in prevention. We're going to deprive people from access to smoking programs in the workplace. We're going to stop young kids getting healthy options when they're at school. And we're going to do all those things at a time when obesity is on the rise, when diabetes is on the rise, when there are people in the community with untreated hypertension who will be having a stroke because we're not doing the things we know that work. Instead, we'll make it harder for them to access medical care. We'll put a price signal in front of their ability to be able to access care. It is absolutely the wrong way to go. And it's with great sadness that I stand up here today and give this speech. Of course, I know what the response will be from government. It's purely ideological. They'll couch it in terms of an unsustainable health system, which is nonsense. No one for a second who knows anything about our health system would say for a moment it's unsustainable. In fact, Commonwealth spending has been going down over the past decade rather than up. No, we won't. We'll ignore that. We'll hear about this great big new bureaucracy that was established by the previous government. Well, give me a break. I mean, what we've got is an independent health authority that has, for the first time, a dedicated focus on prevention. We'll hear that the Department of Health will be able to take up these responsibilities. They weren't doing it prior to the existence of this agency. Once they're gone, so too will be gone the focus on prevention. We'll hear about the nanny state and people's how important it is for individuals to be able to exercise individual choice. Well, let me tell you, when people who are in an environment, an obesogenic environment, are faced with a choice between an unhealthy food option or nothing at all, I know what they'll take. They'll take the unhealthy option. Or when people are faced with an environment where purchasing a bottle of water is more expensive than purchasing the equivalent volume in alcohol, we know what they're going to do. And in fact, one of the most important pieces of work that the Preventative Health Agency did was around the issue of alcohol pricing and the need to reform the dog's breakfast that is the current system of taxation for alcohol, and ensuring that we have a system that reflects price as a proportion to the volume of alcohol in a product. But instead, we have these huge concessions where it's cheaper to buy a litre of wine than it is to buy a litre of water. It is with great sadness that I give this speech. I do, as Senator McLucas has done, I would like to thank the staff involved with the establishment of the inaugural Australian Preventative Health Agency. I think they've done a terrific job. They deserve credit, and I only hope this is a hiccup on our way to the task of ensuring that we as a nation reorient our health system so that we focus more on prevention, that we spend more than the piddly 2 or 3% that we currently do of our health budget on prevention, and start to get the balance right, because we don't have it right at the moment, and this bill takes us in precisely the opposite direction to the direction we should be heading.